Hello, everyone. This is Dr. Kurt Summersgill. Pardon the mess. We're supposed to keep our offices clean during the pandemic, but I've not succeeded. I'm the program director in the residency program in oral and maxillofacial pathology. And I would like to take you on a little tour of the department itself. We're very compact here in the dental school. Much more spread out throughout the university and the UPMC facilities as one goes on rotations. But a lot of the activity happens right here in the dental school. And I'll see if we can stitch these videos together to have you walk around a little bit with our facilities and what we have to offer. Okay, be back in a second.
Okay, so here we go. I'm in my office right now. All right, so this is our laboratory, where we store our paraffin embedded blocks. We have our glass slides, and principally this is where the resident grosses the specimens as they come in. This is also where the administrator or the resident or the faculty person enters the information into the database. These computers connect directly with UPMC. This is, I should say, we're in the dental school right now. These computers are UPMC computers. The residency is an actual UPMC residency. That's why you get a nice stipend. But this is the accession station, the grossing station. And otherwise, it's not very much of a functioning lab. It used to be one, but all the specimens are sent over to UPMC to their central processing facility. That's about it for this room. Going back out the same door and going down the hall. Enter, that's a good idea. All right, so just across from that laboratory is the residence room. I shall actually let you see that. And then this is a locked room, so that the residents have a little bit of privacy. We have spaces for, looks like 5 residents. We're only, UPMC authorizes only 3 residents, so we typically have 1 per year. Here's an example of the microscopes we have. This is probably the best one for the residents. It's actually better than mine. Here's another one that works pretty well. It's also new. We have a couple of clinic cameras, as we can see here. We have right now, the residents are using their own laptops for things, but otherwise we do have computers available for them. We also have here kind of an archive of glass slides, exchange cases from other programs. These are often classic cases or sometimes unusual cases, things we might not get in our own biopsy service. Our biopsy service gets about 2,500 cases per year, and the residents rotate on for a week at a time, but those weeks could be consecutive. So you might even be on for a whole month, which that way you get into the groove, you get used to doing everything. I'm walking now next door into the conference room for the department. We have a big TV and a computer in here as well. With the spacing during the pandemic, we sometimes meet in here, but often we'll meet actually virtually instead. And sometimes we can have meetings with maybe 4 or 5 people in here. That's pretty much it for this room. Back in the good old days, we would have lunch in here sometimes. This is the one of the administrator's offices, also a library with some textbooks in there. Just around the corner down the hall, as you can see, we're coming on a microscope, a very nice one, I think. This is our sign-out room. And there's our mascot, who is not permitted in this room. And here we have a multi-headed scope. Either the faculty member or the chief resident or whoever's in here drives the scope. This is where faculty and residents get together to look at cases. We're also, again, hooked up directly to UPMC. We can pull digitized slides from UPMC. We can pull up the patient records, things like that. So Typically, you spend a lot of time in here going over cases. This is also where we look at our unknowns as one of our courses, seminars. All right, so moving down the hall, we have administrator, department chair, two other faculty members here, general dentistry and oral and maxillofacial radiology. I'll give you a chance to read maybe one of his little calendar jokes. All right. And right next to them, actually right next to the two radiologists, our chair is also boarded in oral and maxillofacial radiology. We're into radiology. There are a couple of administrative assistants in that department to help out the dental students. This is a regular dental school, brick and mortar, with 80 students per class, plus about 20 to 30 hygiene students and about maybe 40 total residents. So some of them spend their time in here. The students definitely go on rotation in radiology, as I'm sure you all did. All right, so just showing some of the hardware we have, and I don't know a whole lot about these machines, but I know we have a couple of panoramic machines and cone beam CT in here. Just kind of going in a square on the outside. Just some more equipment. And then down the hall and out. Lots of other rooms. Very occasionally, the oral pathology residents will use one of these little rooms for pathology consults if the one of the other clinics is busy. So I'm going out into the main hall. And I can kind of face out toward the front door. So this is all on the ground floor. Things in Pittsburgh often have multiple entrances on different levels. So you actually enter the dental school from the ground floor and go up to 2 if you want. You can also enter the dental school on the 3rd floor, the 2nd floor, and the 4th floor. So Pittsburgh has lots of hills in it. All right, we're in the emergency department now. And of course they have their own X-ray unit. And we'll just walk around here. I'm doing this on a weekend, so there are no patients, no faculty, no one who needs to sign a release saying that there are pictures in this video. So kind of a standard cubicle type setup. I think there are 8 chairs here in emergency. The resident generally doesn't have any duties in here unless once in a while they'll substitute for a faculty member. They won't be working as a student. And usually it's in these cubicles here and in the corner where we see our pathology consult patients. And they're typically from the dental school module floors or from the dental hygienists. So I'm creating another square here, exiting, and back into the Department of Diagnostic Sciences. Going past a general dentist office, oral pathologist, Dr. Bilodeau, and back to my office. Just beyond my office is Dr. Prasad, so there are 3 oral pathologists here in the department.